In the United States, New York Governor Andrew Cuomo is extending eligibility for antibody tests after the United States became the most affected country in the world. But the pandemic has exposed inequality, with access to healthcare emerging as a new class divide. Prisoners, farm workers, detained immigrants, Native Americans and homeless families are some of the groups who are most at risk. Dr. Kamara Phyllis-Jones is a physician, epidemiologist and former president of the American Public Health Association. Well, she joins us now from Cambridge, Massachusetts. Thank you very much for joining us. I just mentioned the New York governor. He has previously called COVID-19 a great equalizer. But from your analysis and your perspective, what is the reality in the US? Who is most at risk of getting this?
Well, right now, for the few cities and states who have started to release some of their racial data, we see that Black Americans are highly overrepresented in deaths. For example, in Chicago, 23% of the population is Black, but 70% of the deaths. We're seeing that in Louisiana, and everywhere we're looking now, Black folks have more of it. And what this disease has done is actually to just take the sheets, exposed the racial inequality that is foundational in our nation's history and continues to show itself. With the COVID-19, the deaths are piling up so fast, we can't ignore them. But this same racial inequality is at the root of our excess deaths in terms of infant deaths, maternal deaths, heart disease, stroke, all of it.
Some of the figures you've given there are quite shocking. Why is it the case that there is an inequality when it comes to people who are getting and then dying from this infection?
So it's not that Black Americans are more susceptible, because we know that nobody on this earth was immune to this disease. We all were equally susceptible as of late 2019. It's that we're getting more infections because we're more exposed in frontline jobs, because we can't stay home from work or work from home because we're poor or we're in jails, homeless, all of that. So we're more exposed. And the people on the frontline jobs are also less protected. So the postal workers and the bus drivers are not given the protective equipment that they need. So that's why we're more infected. Then once we get infected, because we have this burdens of chronic disease from living in unequal communities, we have more of the diabetes, the high blood pressure, the kidney disease, all of the things that once you're infected make you more likely to die, and we have fewer resources as well.